The next type of IBS is called IBS-M. IBS-M is a combination of IBS-C and is also a form of IBS-D. So usually if it's going back and forth, if sometimes it's loose, sometimes it's hard, and you're still having all of this symptomology, including pain, they'll call it IBS-M. So those are the three major types of IBS that people will deal with. And then in addition to that, there is a fourth type of IBS. And this is where it gets really interesting, and that is called IBS-U. IBS-U is unknown. They don't understand what's going on with the bowel when there is very unusual things that's happening and it's all over the place. And a recent client of mine, one of her challenges was vomiting. Like a lot of people have bowel movements, you'll eat and you may have to run to the bathroom and have a bowel movement, or you might not be able to go for days. In her case, she would eat and she would vomit. And that is a type of IBS as well. So that's another issue, IBS-U. So we technically have 4 different types of IBS. And as you can see, there is a huge range of things that can happen, and there are a lot of things that can happen within your gut. If you look up the reason why people have IBS, one of the major things that comes up is the medical industry. They say that they don't know. They say that the cause is unknown. The medical industry, they do not know why a person is experiencing IBS. They have a couple of theories why. They say that it could be triggered from stress and anxiety, and part of that is true, but ultimately they don't know why a person has IBS. So if you look at IBS-C, you look at IBS-D, you look at IBS-M, and you look at IBS-U, there's such a range of things. And to be honest with you, usually when you start having challenges with your gut from any of these 4 categories, they're going to begin doing a series of tests. And usually with these tests, they don't find anything. If you go to a really competent practitioner, usually more on a holistic side or a functional side, they're gonna look a little bit deeper and they're gonna find things, but usually they don't find anything, but you have these symptoms. So the truth is that they really don't know, to be honest with you. They don't know what's wrong with you. They know that you have the constipation. They know that you may have the diarrhea, but ultimately they don't know what the issue is at all. So when they're testing you and everything is fine, but you're saying that something is wrong, right? Because you know your body, but they can't find anything, they will usually give you the diagnosis of IBS, but they really don't know what it is. So when it comes to IBS overall, it's really this catch-all term that they use. Yes, there is some inflammation that's there. Yes, there are some commonalities, but I can take 10 different people that have IBS, and there could be 10 very specific things that are going on with these individuals, and it's completely different from each other. And they'll get a specific type. Okay, you're IBS-C, you're M, you're D, you're U. But to be honest with you, they're pulling at straws because they don't really know what IBS is. They just throw that name around when a person has these symptoms and they can't figure out what the problem is.